Okay, welcome everybody. Thank you for taking time to join me here tonight. So tonight I want you to take a look around the room and see how everybody in this room, and know that everybody in this room has been lied to, even myself. Not by our parents and not by your partners, but by the very institutions that we've trusted our health to. For decades, we've been fed on a narrative that has shaped our diets, our medical treatments, and our understanding of the body. And that lie, ladies and gentlemen, is cholesterol. So tonight you're going to hear about sex, lies, and cholesterol. And you heard that right, sex. Why? Because cholesterol is very intimately tied and is fundamental and something more important than clogged arteries. It is our hormones and our vitality. So we're going to take a dive into cholesterol and learn some truths about it. So you ready to hear some truth? So, okay. So this is just a little timeline of cholesterol. It was first discovered in 1769 by Francois, and that's when he identified it in gallstones. And then we jumped to 1910, and that's when Adolf discovered the chemical structure of cholesterol. And then we jumped to the 1950s, and that's when cholesterol was starting to be linked to heart disease. And that is about the time that processed food and high fructose corn syrup was first discovered and started to be put into foods. And it wasn't as much home cooking. It still was a lot of home cooking, but that's where we started to get a lot of the process. Yep, exactly. And then in 1955, that's when John identified the LDL and the HDL. And that's where you hear that HDL is the good cholesterol and LDL is the bad cholesterol. But we're going to learn the truth about those two hormones and what that does. So for decades, we've been told that cholesterol is bad and that we should avoid eggs, butter, and red meat, and that we should eat foods that are low in cholesterol. And those foods that are fat-free or cholesterol-free are usually processed or pre-made foods, and those are very high in sugar. But if we look here in the 1970s, total cholesterol at 240 was considered normal. Nowadays, if you were to get total cholesterol at 240, they're like, oh my gosh, it's bad, right? And in the 1980s, total cholesterol at 200 was considered normal. Now, first statin was introduced in the 1980s. And now they want 200 or less. The much lower of 200, according to the medical community, means you're healthy, right? But we're going to learn some more truths about that actual number. But cholesterol is not bad. If cholesterol was bad, your liver would not make 75% of the cholesterol that's in your body. Our bodies are very smart, and our bodies would not make something that is slowly killing us or actively killing us, right? Your liver makes 75% of the cholesterol, regardless of how much cholesterol you consume. And about 25% of the cholesterol comes from your diet. Now, this is also where you hear about HDL and LDL, HDL being good and LDL being bad. They are both the same. It is just the particle size. HDL means it's a bigger particle and LDL means it's smaller, and VLDL is even smaller particle size. Now, what happens is the environment that these particles end up in, they can wreak havoc on the body. So what causes havoc in the body? Chronic inflammation and oxidative stress. Now, what causes chronic inflammation in the body or oxidative stress? Our very friendly, lovable thing we love to eat, sugar. And carbs, right? So HDL and LDL are out there trying to repair the arteries that are trying to spring a leak, right? So they're trying to repair the damage that's going on to prevent more damage in the body. So let's look at the liver here. So our liver produces approximately 1 gram of cholesterol, which is about 75% of the cholesterol in our body. Now, there's an enzyme called HMG CoQ reductase. It doesn't matter to you, but that is what statin drugs block. So statin drugs block that so that your liver cannot produce cholesterol. Cholesterol is very healing in the body. That's what comes out and increases when there is inflammation. Your body liver produces the LDL, HDL, VLDL. So HDL is produced by the liver, and that goes out. It's a suitcase. It goes out to pick up LDL and VLDL and bring them back to the liver. Now, when there's inflammation in the body, LDL goes out to try to correct that inflammation and to heal that whatever is inflamed. But HDL goes, no, I don't want to go out there. It's too scary. There's too much inflammation. So LDL stays out there and becomes oxidized and doesn't come back to the liver. When it gets oxidized out there, that's what causes the plaquing of the arteries. And plaquing of the arteries and the chronic inflammation is due to diet, not because you have too much cholesterol. You have too much cholesterol because of diet, which is causing inflammation, and the body's trying to heal and repair itself. So we're going to play a little game here. Oh, it is. So I'm going to give a couple questions, and we're going to decide whether it's fact or fiction. So all cholesterol is bad for you. Correct. I should be throwing out sticks of butter to whoever answers it right. That is a myth. So now we're going to go to, there are two main types of cholesterol, LDL and HDL. And true, right, correct. And the liver makes most of the cholesterol your body uses.
True. Yes.
Very good. Y'all, that's right. Y'all are paying attention. I love it. Only people that are overweight have high cholesterol.
Big fat lie.
That's true. That is correct. That is not true. So let's look at how diet affects our cholesterol. So sugar, carbs, processed foods, which are high in sugar, causes inflammation in the body, which then causes your cholesterol to rise. So it's not so much the cholesterol number itself, it's all the other counterparts that tells us why cholesterol is high. So when you look at your cholesterol numbers, most people just go to cholesterol and say, oh, my cholesterol is high, but you're not looking at the whole picture. And the whole picture is not just your LDL, your HDL, and your triglycerides, but it's other markers such as your glucose, fasting insulin, and your thyroid markers as well. So there's much more that goes into it. And even your inflammation markers such as C-reactive protein and homocysteine, they give a better picture as to why cholesterol is high. And trans fats have a bigger impact on your cholesterol. And trans fats are in processed foods and your McDonald's and all these quick stop foods, and canola oil, vegetable oil, all your bad fats. Peanut oil are trans fats, which cause inflammation in the body. And obviously sugar and refined foods as well. So in September 1st, 1987, the first statin was introduced. And that's when they started lowering the standards for cholesterol. And statins, there is a place and time for medicine. I'm not saying all medication is bad, but what statins do is they block that enzyme in the liver so your liver cannot produce cholesterol. But remember, our body is smart and our body produces cholesterol for a reason, especially if there's inflammation. So not only are we stopping cholesterol production, we are also stopping the production of many other steroids that are essential for the body. So some side effects of statin drugs. So when statin drugs were first introduced, they said if you had any kind of muscle pain to go back to your doctor so they could adjust the dosage, because what statin drugs do is they kind of slowly start eating away at your muscle. It's a form of what we call rhabdomyolysis. It eats away at your muscles. And now they're just like, oh, you're fine. It's okay. Just it'll get better with time. Yeah, that too. So it causes a lot of muscle pain, but it also causes a lot of memory issues because our brain is what?
Made out of cholesterol.
Fat, right? So if we start decreasing the amount of fat that our liver's producing, and then we stop eating good fat because we're scared that we might raise our cholesterol, we start having memory issues. We also start having neuropathy because what are all of our nerves covered in? They're covered in something called myelin. That's right. And what is myelin primarily made up of? That's right. cholesterol. So think about your house, your wires. You don't want bare wires touching, right? Because then they short circuit and you could have a fire. So you like that insulation on there to protect. That's what myelin is, to protect the nerve function. So when you start having bare nerves touch each other, they start short circuiting, hence the neuropathy, the pain, numbness, tingling that you start to experience. And that can be because of cholesterol medication. And then obviously fatigue and sleep is affected as well too. So not only do we get these side effects of medication, it also depletes our body of many essential nutrients. So when you're taking a statin drug, you're going to deplete your CoQ10 levels, and CoQ10 is essential for heart health. But most importantly, your body cannot make vitamin D. You can be out in the sun all day long and your body will not make vitamin D, because that pathway that statin drugs block also blocks the production of vitamin D. And vitamin D is essential for hormone health. It also depletes your body of vitamin K2, which is essential for clotting, and selenium, which is essential for thyroid health, and zinc, which is essential for your immune system. So you could take supplements to negate this, but essentially it comes down to diet. So over here we see cholesterol at the very top. Cholesterol is not just this little molecule that's floating around in your blood, just waiting for a party. It is essential for all steroid production in the body, from estrogen, progesterone, testosterone, cortisol, and vitamin D, because vitamin D is more of a hormone than a mineral in the body. So if we block the production of cholesterol, then it's going to affect everything else downstream. So it's a building block of every single steroid, like we talked about, all of that there. What happens when your body can't produce these vital hormones? Well, this is when we start getting symptoms of many women who have low estrogen start experiencing hot flashes, mood swings, sleep issues, depression, weight gain, decreased libido, dry skin, thinning hair, and they're not producing cholesterol because they're on a statin drug that's blocking the cholesterol production, and their body's not producing the hormones. Now, you can also see this in men. Decreases testosterone production. This is, you see all the commercials now. Do you have low T? Come get this injection or take this pill so that we can increase your testosterone, right? Exactly. It's not going to work because the body's not producing cholesterol to make the hormone. So it's a short-term fix, but not a long-term solution. And these are things that happen with low testosterone: decreased libido, mood swings, erectile dysfunction, loss of muscle mass, and increased body fat, sleep issues, hair loss, and just overall affecting quality of life. So this is why cholesterol is so important. Lifestyle also affects cholesterol, not just what we eat, right? Regular exercise, and it doesn't have to be, hitting it hard at the gym for an hour, but just walking helps increase your HDL and lower your LDL. LDL, remember, is what stays out there, and if that gets oxidized, that's what causes the plaquing. And we want HDL to not be scared and go out there and pick up that excess cholesterol. Stress, what is that, right? Nobody's under stress. Will increase cholesterol because as cortisol increases, cortisol is our stress hormone, and that causes the body to produce more cholesterol. So there's always a reason why cholesterol is high, right? So you have to be the detective to try to correct that issue. And lack of sleep also affects cholesterol metabolism. We should be getting 7 hours of sleep. Some people say they function on 5, but essentially we need 7 hours of sleep. If you can do more, that's fine, but essentially we need 7 hours. Our bodies really need that sleep. And everybody's different, but essentially our goal is 7 hours of sleep. And alcohol, because it is a sugar, will raise your triglycerides. I know that's what a lot of people don't want to hear. But so here we come to testing, right? And a lot of times we just get told what our total cholesterol is, or we do a lipid panel, which includes your total cholesterol, LDL, HDL, and your triglycerides. Cholesterol will be high, especially if your triglycerides are high. Triglycerides are a marker of sugar and carb intake. So when I see triglycerides high, I know that you are consuming lots of sugar and carbs. That's causing inflammation in the body, which in turn is going to make cholesterol a reason, and we have to figure out why we have, if it's not diet oriented. So if we have high triglycerides, more than likely we're going to have some kind of metabolic issue. You might be diabetic already, or you might be borderline diabetic, right? So this is when we want to look at other markers as well. We want to look at your C-reactive protein. That's an inflammation marker. If that's high, we know there's a reason why why cholesterol is high, because inflammation is high. If homocysteine is high, that's another marker for cardiovascular risk. There's a reason why cholesterol is high, so let's be a detective. And fasting insulin and glucose. If those are high, triglycerides are going to be high, hence cholesterol is going to be high. So by giving a statin, just because cholesterol is high, you're decreasing cholesterol, but you're not correcting any underlying issue, and the problems are just going to get worse. And then thyroid test, because hypothyroidism causes high cholesterol. So your diets could be perfectly normal and no sugar or carbs, but you have a hypothyroid, that can cause your cholesterol to be high as well. So that's why it's important to understand your numbers, not just to get a number and say, oh, my cholesterol is high, I better get on a statin drug. There's other ways to resolve this. Like I said, there is a place and time for medicine. I'm not saying medication is bad, but we want to get down to the source of the problem and correct that issue, because cholesterol is very important to our vitality. And the total cholesterol doesn't tell the full picture. It's the triglycerides that are important. Now, many of you may have heard of blue zones. Now, obviously, the United States is not in a blue zone area. There's only Loma Linda in California that's considered a blue zone area, but it's Europe and other parts of the country. Now, the blue zones, these are areas where people have long longevity. They live 100 years and longer. And their cholesterol levels are about 190 to 210. And even though they have a very high fat Mediterranean diet. Now, the higher your cholesterol is, the healthier you are and the healthier your brain is. Now, some people have a genetic issue to where their cholesterol will be in the 500 range no matter what they do. But that is because of a genetic issue. And when you do a genetic test, you can figure that out, and that will coincide with high HDL and LDL, and then it's a different level for them. But these people eat lots of good fat, eat lots of animal protein, vegetables and fruit, and their cholesterol is high, yet they have the lowest rate of heart disease, even though they have high cholesterol. So cholesterol is not a foe, it's a friend, right? We just want to make sure that we are not eating foods that cause inflammation, which then causes cholesterol to go up. And so the importance of social connection, balanced nutrition, just being active really helps your well-being and longevity.